The 37th Great American Smokeout is tomorrow, a time to encourage smokers to make a plan to quit and take charge of their health. Joining us from Wing Memorial Hospital and Medical Centers to share more about what is being done to make a difference is Dr. Vijay Kasturi. Great to have you here, Dr. Kasturi.
Thank you for having me.
Everyone knows smoking is bad. You hear it all the time, but what are the statistics that prove it?
Well, 1 in 3 deaths from cancer are related to smoking. 1 in 5 deaths from all causes are related to smoking. Currently, about 1 in 5 people in the United States, U.S. adults, are smokers, which is about 45 million people altogether. And what's a little alarming among that is that about a quarter of those people are between the ages of 25 and 44.
So they're very young.
So they're very young, and that is alarming because a lot of those people are at risk for developing cancers like lung cancer or throat cancer, and also having heart disease.
And November is Lung Cancer Awareness Month, so it's a time to really be aware and obviously to kick the habit.
Absolutely. This could not be a better time. About 1/3 of all cancer deaths are related to lung cancer, and that's more cancer deaths than breast cancer, prostate cancer, colon cancer, and pancreatic cancer combined. So it's about 500,000 people dying from lung cancer every year across the world, which is a tremendous loss in health and human life.
Absolutely, but Wing Memorial has a lot to offer to help people, and of course, when it comes to screening and checking for lung cancer.
Absolutely. So recently, actually, a large national trial was done by the National Institutes of Health, which showed that screening with low-dose chest radiation, low-dose CAT scans of the chest, which give very low amounts of chest radiation, even less than that of a chest X-ray, can actually pick up lung cancers quicker. And the population at risk in that study was between the ages of 55 and 74, who were either active smokers or had quit within the last 10 years. So they were able to pick up cancers quicker and actually were able to cure some of them by offering them surgery, for example, or other directed therapies. And the CAT scan was compared to chest X-ray in that study. This is a study of almost 20,000 people, and the CAT scan was better than the chest X-ray in picking up cancers. So screening is important.
So important, absolutely. And you were telling me earlier about how minimally invasive it is, and there's some incredible technology that's making a difference.
Yeah, so surgery we're making lots of advances in surgery for lung cancer. The traditional surgery is to make a big cut in the chest, about 6 or 7 inches long, and then go in and go into a lung and take out the tumor. And these days at UMass in Worcester, we have pioneered minimally invasive surgery using the Da Vinci robot, which is also used for surgery in prostate cancer and also in gynecological cancers. This involves making 4 tiny cuts in the chest, putting a camera in there, and the surgeon actually sits and manipulates robot arms that go in through very, very tiny incisions. And the articulation of the robot is actually very fine, so the arms of the robot can actually do surgery much better than what a human hand can.
It's incredible.
And the patients have less pain, less bleeding. They're discharged from the hospital within a matter of a day or 2, as opposed to the traditional 4 to 7 days.
Which is what everyone wants to hear.
Absolutely.
And there are several doctors that always work together in diagnosing and
that's correct.
Making sure everyone's healthy.
We have a multidisciplinary team at Wing Hospital that is involved in the care of patients with lung cancer. We use a thoracic surgeon, a chest surgeon. We have 3 at UMass who also visit Wing. We work with radiation oncologists at Mercy Hospital and at Harrington Hospital, which are the 2 hospitals that bridge Wing, along with medical oncologists like myself and 2 others who are at Wing. We discuss every patient in a multidisciplinary tumor board and put our heads together to come up with the best treatment plan for that patient, so that care is individualized and it's not just one person's decision in what care that patient should get.
Right, which is wonderful to know, of course.
Absolutely.
That people are working together to take care of you.
It's the way I would want to be treated, is having as many doctors as possible put their heads together to tell me what the best treatment is for my type of cancer. We do have clinical trials available for patients who have more advanced disease. There are some newer agents that have come out in lung cancer recently, newer targeted agents, which unlike traditional chemotherapy, They actually work by targeting specific proteins on the cancer cell or inside the cancer cell. So they don't carry the side effects of chemotherapy like hair loss or nausea and vomiting. They have far fewer side effects, in fact, are very well tolerated. And so we do specific genetic testing of patients' lung cancer tumors to find out which of those genetic changes might be present, and we have about 3 drugs available right now that can target those changes. We have more coming down the line.
Technology is really incredible. It's making such a difference. And really quickly, tomorrow is the Great American Smokeout. Yeah. Why should people make the pledge to quit?
Well, smoking is not just a personal problem for people who are smoking, but it's a national health care problem. 96 billion with a B dollars are the direct medical costs associated with people who smoke. And that's estimated by the Centers for Disease Control recently. That's contributes a lot to the federal deficit as well. So it's very important that we try to reduce that by actually encouraging people to smoke and improving their health. The Great American Smokeout goes a long way towards that. There are many programs available in the community to help people smoke. We have a program called Quit Works that patients can enroll in, which gives them access to a health professional who can provide counseling as well as access to medications which could be helpful to quit smoking.
Bottom line, just you have to quit. So for many reasons. Thank you so much for being here, Dr. Kasturi.
Sure. Thank you very much for having me.
And if you would like more information on the services available at Wing Memorial Hospital and Medical Centers, log on to winghealth.org.